A lot of you guys have been texting us questions about the coronavirus this morning. It can seem a little bit overwhelming, but we want you to know, of course, that we're here for you. We're going to get through this together. We want to spread facts, not fear. Just in the last couple hours, dozens of text messages. So we've been saying that we're bringing in a doctor. Here he is. Dr. Sid Fletcher is here to answer as many as possible. He is the Chief Clinical Officer at Novant Health. Good morning. Thanks for joining us.
Good morning, Rachel. Thanks for having me on the program.
Yeah, absolutely. So we want to start off with recognizing symptoms. There are a handful that people can be aware of. And then what do people do from there if they feel like they have some of these symptoms?
Certainly, thanks. So like other viral illnesses, coronavirus symptoms typically relate to things like fever, body aches, cough, and at times sore throat as well. So obviously those can be nonspecific and can be related to multiple other types of illnesses, or for some people even allergy symptoms, right? So I think one of the things that we're stressing to do is trying to reach out to your primary care providers. At Novant Health, we've provided an 800 number as well where people can call to get information on what next steps to take.
Okay, and I know we have that 800 number at the bottom of their screen so that they can call if they do have any questions. So who would be the appropriate candidate to get screened for the virus?
Sure, so I think certainly those that have had a close personal contact. We know about travel history. Travel history has become less relevant than it perhaps once was, as we've seen the cases across the country now hit this morning when I looked on the Johns Hopkins website at approximately 3,000. There were last about 156,000 across the world. So here in North Carolina, we saw the most recent report this morning that there were 25 confirmed cases. So as we see more cases in the state, the travel part may become a little bit less relevant. But I think people that have the symptoms that we talked about, fever, cough, body aches, those kinds of things, may need to get not only screened, but may need to get treatment. One of the things that we're emphasizing again is to reach out first, whether you're going to go to your primary care office or not. Novant Health has set up some additional screening centers. One of those is up and operational in Matthews. We have another one that will be operational in Huntersville this coming Wednesday. We also can test at any of our Go Health urgent cares, which are a co-branded urgent care with Novant Health. So they can also test, and we can test out of our primary care offices, but I would emphasize we want to have those calls ahead of time so that we get patients in the right locations. We also want to ensure that we don't have everybody coming to the emergency departments at either Novant Health or I would say Atrium Health as well. We obviously are in lockstep with the county health department and with other healthcare system partners within the community.
Okay, we'll talk about flattening the curve in just a minute, but first I want to ask you about the higher risk patients and them being the ones that you of course want to be able to treat, which goes hand in hand with we don't want our healthcare system to get overwhelmed. From a doctor's perspective, what is your opinion on that and what's your advice?
Yeah, so what I would say is certainly those that are the most at risk have really come into three distinct and identified groups. Those age 65 and older, right? Those who have chronic healthcare conditions, think about things like COPD, et cetera. And then the other category, of course, is those with compromised immune systems. That might include people who are under cancer treatment, or even people with diabetes. So those are kind of the three biggest at-risk groups. If they have clinical symptoms, especially with cough and fever and shortness of breath, they may need treatment at a facility. They might need oxygen or additional breathing treatments, things like that.
I know we don't often use the words flattening the curve until we're finding ourselves in a pandemic. So kind of explain it, I like to say in elementary terms, to people that are not familiar and why this is being talked about so much right now.
Yeah, Rachel, thanks for that question, because there's a lot of this out in the media, right, around this flattening the curve. It sounds a little sciencey. Just to make it easy for everybody, what you really need to know is the whole concept of flattening the curve is just that we don't want everybody in our community to become ill at the exact same moment or within a very short duration, right? That would make a really steep curve. And what would that do? It would overwhelm the resources and capabilities that we have in place today. So what we really want to do is do the things that you've heard the governor talk about, that you've heard Gibby Harris with the Mecklenburg County Health Department talk about, which is really trying to limit your exposure to large gatherings. So something with 100 people, you want to stay to less than 100 people. You can see what's happened with school closures, what's happened with churches that are not having services as well. So especially if you're in one of those at-risk groups, I think you want to try to do social distancing, not be very near other people. And certainly we do want to very much tell people no shaking hands, those kinds of things. Perform hand hygiene frequently, meaning use Purell, soap and water, those things to make sure that your hands are clean.
Okay, so we want to get to a few more questions we didn't get to answer about 30 minutes ago. First, people are asking about the first symptoms that they may notice. What is that, and what are some of the symptoms they should just be on the lookout for?
Well, again, the typical symptoms that we're looking for would be those of cold upper respiratory type infection is typically how it starts. So cough, fever, body aches, or even sore throat are some of the primary symptoms that we'll see with this virus, like many other viral illnesses.
And I've seen a lot of questions about, I am 65, I'm 70, I have this underlying health issue. How concerned should I be?
Well, I think for those individuals, certainly not everybody may have the means to do so, but what I would certainly recommend is help if they're going out into social situations. You'd want them to have what we term social distancing, so staying 6 feet away from other people. And if they could have others help them, that might be to get groceries, other things like that, that would be useful.
So it's the weekend. I know Friday and Saturday, bars and restaurants packed. Even yesterday, those places filled with people after the governor announced that people should not be gathering of more than 100 people or more. And you just mentioned social distancing. Is this virus airborne?
Thanks for asking that question. You know, early on with this virus, so coronavirus is one of a family. We are very familiar with coronaviruses, and in fact, you know, many of us as adults, you've been exposed to or have had a coronavirus, not this novel coronavirus or COVID-19. So with that said, we had an experience with coronavirus. So when it first came out in China, we were unclear whether it was respiratory spread or not. The CDC really recommended respiratory precautions at the beginning of this because we weren't sure how this particular novel virus was acting. Now that we've had our own experience in the US, unfortunately, and we've seen enough cases, the CDC has actually lifted the respiratory isolation. So what that means is that this is not airborne. It does mean that this very heavy virus, if you cough, sneeze, etc., it will fall onto surfaces. And if you were to touch that and then touch your face, as I was mentioning to others, we touch our face several thousand times a day. You certainly would be at risk for contaminating yourself if the person who was coughing or sneezing had an active case.
Okay, and that is why we can't reiterate enough washing your own hands, cleaning your surfaces constantly. A couple more questions before we let you go. Again, so appreciated. This is invaluable information. Is the concern of this coronavirus pandemic now being exaggerated or not?
I would say that we don't believe it's being exaggerated. We're taking this very seriously, and at Novant Health, we have been making preparations for several months as we've seen this come forward, and I think we've seen that response within our communities as well. Everyone from public health to our partners at Atrium Health as well. We've been partnering with them to make sure that we have preparations in place. We think that's critical so that we're prepared not only to take care of our communities and patients, but to ensure our team members who are really on the front lines of this are kept safe during this so that we have an ongoing ability to continue to see patients.
Okay, and I do want to reiterate to people that aren't showing symptoms, is it possible that even if you don't see an active symptom right now yourself, that you could still be a carrier of the virus and impact other people?
Yeah, what I would mention on that is that it certainly is possible that someone could have it and have relatively light symptoms, and we see about 80% of patients that may have it will have relatively mild symptoms, which may include mild fever, maybe runny nose, maybe a mild cough. That said, the people that are shedding the most virus, that we believe that if you were in contact with them, you would be most at risk, are those that are having more symptoms or having symptoms at all. So having cough, runny nose, fever, body aches, etc. They're going to be a higher risk to you personally than someone who would, say, have no symptoms whatsoever.
Okay, thank you so much. I want people watching right now to know that we have your Novant Health helpline number at the bottom of our screen for people to call with any questions. And ultimately, our goal is to prevent community spread, prevent our healthcare system becoming overwhelmed. So this information, again, is invaluable. Thank you, Dr. Fletcher, for joining us on WCNC Charlotte this morning.